Now we continue our very important medical talk with Dr. Darren Green this morning because the month of March is Tuberculosis Awareness Month in South Africa. We had a call earlier on from Sipho in Khayelitsha who wanted Dr. Darren Green to just maybe revisit those symptoms again. How do you know that you have TB?
In a nutshell, chronic cough, greater than 4 to 6 weeks, not clearing up with treatment. Then obviously things like loss of weight, night sweats, where you can actually wring out the sheets from sweating at night. And then, of course, obviously, things like a bloodstained sputum.
And then we had a call also from John in Brits, who said that he had been diagnosed with TB of the urinary tract in August. He's been on treatment for 3 months. That's what he was expecting in terms of the length of time, but he's having to continue. How long can he expect it to take?
Yeah, so when it comes to TB outside of the lung, in terms of systemic TB or miliary TB, it can manifest in the bladder, the bones.
So it's not just the lungs?
No, it can start in the lungs, or you can have independent TB, where you even have things like in the nervous system, meningitis, TB meningitis, that forms like a Melrose cheese-like layer around the brain, and that, like cling wrap around the brain. It actually causes inflammation of the brain. And in children, if that's not diagnosed early, they can become deaf, blind, etc. So certainly for him, difficult to treat because of the penetration of the drugs and the antimicrobials that he's on for the bladder. It would need a revisit and perhaps even repeat biopsies to see whether it's cleared up completely. It's not as easy as doing a sputum test, for example.
And in terms of the treatment, like he was asking, John, how long can he expect it to take?
6 months is the traditional treatment for simple tuberculosis, but often if the results haven't cleared up completely on lab testing, we continue that phase of treatment to 9 months.
Now, one very interesting fact is that TB is the leading cause of death among people who have HIV in Africa. So what's the link between the two, HIV and TB? Yeah,
it's interesting. In the Western Cape, for example, 70% of people that have TB of the lung have HIV. So the association obviously goes hand in hand with the immune system due to the chronic inflammatory markers that are released in the bloodstream, etc. You have then the weakening of the immune system. HIV lowers your immunity, makes you vulnerable to an opportunistic infection, and the other way around as well. So tuberculosis also obviously results in a bit of a weakened immunity.
Yeah, and also I'm sure there are many stigmas that we need to be aware of when it comes to TB and HIV. What are some of those that we need to
Of course, so a lot of people think it's a death sentence. If living with tuberculosis is something you can counter, especially if early diagnosis is made and you're compliant with your treatment, if you finish your 6 months of treatment and you don't skip days and you modify your lifestyle around eating healthy to build up your immune system, you can cure TB. It's a curable disease. Sometimes there's scar tissue that in the lungs that we looked at earlier on that remains, but the disease and the infection is then cured completely. And that's what people need to understand.
Well, it's good news to hear that. And as we continue this chat on this very important medical topic, Tuberculosis Awareness Month in the month of March in South Africa, our lines are open to talk to Dr. Darren Green, 08391 33728. We'll see you shortly after the break.